You're listening to the ADHD Heroes Podcast, a podcast where we speak with the heroes of the ADHD community, namely educators, mental health professionals, and of course, those with ADHD themselves, to gain insights, tools, and most importantly, inspiration towards succeeding and thriving with ADHD. I'm your host, Rabbi Shmuel Reich, a high school Rebbe and an ADHD coach in private practice. Welcome to the show. Hi there. As mentioned last week, this episode is coming out early because next week is Tisha B'Av, wishing everyone an easy fast. The following episode will come out the following week, returning to our schedule of every other Thursday. ADHD and sleep, as you probably know, have a complicated relationship. So, to address this important subject, on this week's episode, Dr. Lancer came back on the show for another conversation. We discussed what the challenges of individuals with ADHD are in the context of sleep, how poor sleep can further impair executive function, the circadian rhythm, and how it is affected by ADHD, strategies including something called sleep hygiene, why this can be difficult to implement with ADHD, and how ADHD coaches, like me, pardon the shameless plug, can help, sleep apnea, the effects of ADHD medication on sleep, restless leg syndrome, control of light and screens to improve sleep, and a lot more. Quick shout out to the Chinuch Today podcast, hosted by former ADHD Heroes podcast guest, Rabbi Yerachmiel Garfield, and on to the episode. Enjoy. Okay, Dr. Lancer, welcome back to the ADHD Heroes podcast. I'm excited for our conversation today.
Very excited to be back.
Okay, great. Anything you want to update us on with regard to your bio since we last spoke?
I am still me. I'm still seeing people and treating people. No big changes, but it's been busy. A lot of people need help.
Okay, so it's good that you're helping them. And with regard to known changes, no news is good news.
Yeah.
Okay, so we have a lot to talk about today. We're talking ADHD and sleep. So let's dive right into it. What are some of the common challenges you find with individuals who have ADHD with regard to sleep?
So ADHD and sleep, they kind of have this bi-directional relationship. But you'll see that, there's nothing in the criteria for ADHD that pertains to sleep, but there should be. With people with ADHD, what we commonly see is people have a delayed sleep onset. They're tired, but they're wired. Sometimes they have racing thoughts. They have difficulties turning their brains off. They're inconsistent with their sleep chiming, weekdays versus weekends. They're restless, or the sleep is fragmented. They have daytime fatigue. As we know, in attention and hyperactivity and fatigue can kind of look the same. So there's a lot kind of going on there in this interplay of sleep and ADHD. And it's not always about less sleep times. There's differences in sleep quality and in architecture. We see less deep sleep, less slow wave sleep, and we see altered brainwave activity, lower delta power, as they say.
What's delta power?
In general, it's just the different levels of sleep that you're getting.
Oh, God, okay.
Everyone's heard of a REM sleep, so it's something along those lines. But you're really getting in the nitty gritty of sleep medicine there.
Oh, God, okay.
Poor sleep quality correlates with worse next day executive functioning. I mean, that's kind of common sense, right?
Right.
So sleep deprivation can look like ADHD. ADHD can look like sleep deprivation. And then in kids, sleepiness often presents as hyperactivity. So it's kind of important to make sure you're dealing with the right thing.
Is that what we call being overtired? When you said sleepiness can look like hyperactivity?
Yep. I've been dealing with it for the past 2 years. I have a 2-year-old.
Oh, got it. Okay. So where do we start? Let's take them one by one. How do we address these different challenges?
So I think it's important to talk about a circadian rhythm. Everyone's heard of this, I assume. It's our internal 24-hour clock that regulates when we fall asleep and when we wake up. It's driven by this little thing in our brain between our eyeballs, driven primarily by light. It's powered by melatonin. Our body makes its own melatonin, right? And then in ADHD, what we see is that that's often delayed. So a lot of people with ADHD, myself included, were night owls. And then there's with that there's this mismatch between our circadian rhythms and work or school. So you incur this chronic sleep debt, right? You're always trying to catch up.
Yeah, are they related fundamentally? The circadian rhythm and the ADHD. I mean, are they? What's the relationship between the two? I guess neurologically, without getting in the
Well,
weeds too
it's
much.
yeah. So people with ADHD, their circadian rhythm is a little bit delayed, meaning they're like I said, they're night owls. So it's a 24-hour cycle, but it's later. You go to sleep later, you wake up later. We call it delayed sleep phase.
Right? Is that part and parcel of the ADHD? And if so, how does it relate to, I don't know, the executive function or dopamine or the other ADHD components of the brain?
Hard to tell. We know there's this association. Like I said, with regards to the DSM, there's no mention of sleep with ADHD, but I think in the future we're going to be headed in that direction of kind of looking into that.
Okay, yeah, it would definitely sound good for the DSM to update their info on ADHD. I guess
Mhm.
we're probably not the only ones who think so, right?
Yeah.
All right. So as far as strategies, what do you recommend for the different challenges we're describing?
Right. So what do we do about it? It's a question I deal with on a daily basis.
Right.
So there's different ways. So behavioral approaches. So you want to make sure you're going to sleep at the same time, you're waking up at the same time. I almost have this conversation with all my patients at some point about sleep hygiene.
Right.
Um, you want to have a winding down routine. You want to have a morning routine. Our brains are very smart, but they're very dumb. They need to know. They're into routines, and if there's no routine, it kind of freaks out. So before bed, you want to reduce stimulation. Don't read the news before bed. In the morning, you want to turn on the lights. You want to look out the window, go outside, right?
Yeah. So if I'm understanding correctly, what all these things are doing are informing the brain.
These are behavioral modifications, and yes, this is training the brain. This is the time we go to sleep, and this is the time we wake up. Dark means sleep. Light means up. Our brains catch cues. Oh, we're brushing our teeth. That means that we're going to be sleeping soon, right? So yeah, it's the same reason is when you have a newborn, they tell you give the newborn a bath so it goes to sleep easier, right? So those things don't change when we get older.
Okay. So what are the likely hurdles that arise when we try these?
So I mean, behavioral modifications, they're easy to tell people to do. They're hard to incorporate, and that's why there's more than that. So there's physiology. You can target the physiology. You can give melatonin. You have to give melatonin at the right time. A lot of people give melatonin a little too late. They give it right before bed. You got to give it, kind of at dinner time. Light therapy. You can buy. There's these lights and there's specific numbers that you have to have of the degree of brightness to wake you up in the mornings, especially if you live in the Northeast and it's still dark when you wake up, right? Then there's evidence-based approaches, CBTI, so CBT, cognitive behavioral therapy. I is insomnia. So there's a specific protocol for people with insomnia, and then this works and works really well. There's a lot of professionals that are certified in this. There are apps out there that do this. I think the VA, the Veterans Association, has an app that's free to everyone that incorporates this.
Well, that's cool. What is it? Like, what is it broadly?
What is CBTI?
Yeah.
It's kind of it's just tracking when you're sleeping. What are you doing? I don't know the intricacies, to be honest with you, but it's behavioral modification, but in a more regimented fashion.
Got it. Okay.
And then there's all kinds of combinations and different things coming out. So transdiagnostic sleep interventions is a name that people are saying. That's a combination of CBTI plus the circadian stuff plus the behavioral interventions. And so when you do all of that, you see improvement in sleep and attention. And then to go a step above that, sometimes you need to adjust schedules if it's possible, like later school times or later work times. If you are someone that works overnight, you have to really consider, is it worth the health effects? So it's nature, nurture, it's biopsychosocial, it's all of it combined.
I got it. So those if I'm understanding correctly, a lot of that is going to help for the getting to sleep on time and probably for waking up also. Am I getting that right?
Yeah, yeah.
Will it affect the quality of sleep also?
Of course. Well, one thing that we haven't mentioned, I think we're going to get to it later, is the different, sleep issues that can play along. So, obstructive sleep apnea, for example, is a big topic. I screen almost everyone that says they have executive dysfunction for obstructive sleep apnea. So if you have sleep apnea, not only, are you not getting enough sleep, but the sleep that you're getting is not good sleep.
To clarify, it sounds like, if I'm understanding correctly, you're saying that if someone has sleep apnea, it could be they're not getting quality sleep, and then because they're not well rested, that's manifesting as ADHD symptoms, but it's not ADHD, it's sleep apnea.
Correct. 100%.
Whoa, that's incredible.
Yeah.
What do you do for that?
I give them a sleep study. Nowadays, they have these at-home sleep studies, and it's very simple. It's like a watch device. You wear something on your wrist. There's a part that goes over your finger. They might have like a sticky thing to put on your chest. Connects to your smartphone. You sleep, and in the morning, it sends the results to a sleep doctor. The sleep doctor looks it over, and they send you the report. There's companies that do this. You can do this with the doctor. There's different ways to go about it, and then you'll get your diagnosis, whether you have mild, moderate obstructive sleep apnea, severe obstructive sleep apnea, and then it's up to the patient and their sleep physician to decide what's the best course of action if they have sleep apnea, whether that's a CPAP mask, or that's a mask that kind of forces air into your airway to keep it open, or they have dental devices. Nowadays they have implants that stimulate nerves to keep your airway open. So there's it's a whole thing in itself, sleep apnea, and it affects people in multiple ways. Medically, neurologically, psychiatrically, high blood pressure, cholesterol. It's the only preventable form of dementia, anxiety, depression, ADHD. It's one thing that affects a lot of things, and it's widely under screened and underdiagnosed.
Wow, how common is it for somebody to come in thinking they have ADHD and turn out that they really have sleep apnea?
I would say it's more common than you think. I've had young people come see me, and I ask them, do they tell me, I'm kind of foggy during the day. I'm tired. I take naps. I can't concentrate. And I say, do you wake up with a dry mouth? Do you wake up with a headache? Does someone tell you snore? And people don't know if they snore, right? So a lot of times they'll be like, "Oh, my uncle has sleep apnea. I don't think I have that." I'm like, "Just do a test. Just do the test." And they end up doing it, and they end up telling me, "You were right. I had moderate sleep apnea. It just happened to me not too long ago." I
Right.
had a patient was like, "You were right."
Well,
Um, and we're the common misconception is that it's a heavier individual that has sleep apnea, but it's not necessarily the case every time. I've had very thin, lean people that have sleep apnea, severe sleep apnea. So it's more than just a weight thing.
right. Wow, so really, really goes to show once again the value of the inaccurate diagnosis. Am I correct?
An accurate diagnosis and a holistic view of the person. People who say the word holistic, they mean all kinds of things. But holistic just means you're looking at all the different parts, right? So you can't just look at things through one lens.
All right. So you mean if we're looking at ADHD, we're looking for ADHD, but we are even if we're looking at a wider range of mental health challenges, that's still not the whole story. I'm getting it right?
Yeah, I mean, just because someone has inattention and can't focus doesn't mean they necessarily have ADHD. There's more things to look at, right? So that again, it goes to show that you can't turn a symptom into a diagnosis. You have to see the whole picture.
What tend to be hurdles along the way of the interventions you mentioned before of creating better sleep hygiene? What tends to be difficult along the way?
So people with executive dysfunction, if we wouldn't be having it's hard for them to make behavioral modifications because they have the executive dysfunction. So we see a lot of what we call social jet lag. So like, they stay up later on the weekends and they have to make up for it during the week. So that's one thing. And then people with ADHD, they kind of hyper focus. So at night, we call it revenge bedtime procrastination. At nights, they use that time, the nighttime, to kind of do the things they're interested in. And so they stay up and they hyper focus on the stuff that they want to do when they should really be sleeping. You know, People with ADHD and executive dysfunction, they have trouble with adherence to anything. So, that's I would say the biggest hurdle. ADHD patients are more sensitive to sleep loss at a brain level. Even one night of sleep deprivation can impair brain connectivity and performance. So, they got to get it right. Otherwise, there's a lot to lose.
Got it. So, if I'm understanding correctly, it sounds like you're saying when they're short on sleep, it affects them more than everybody else.
Mm-hmm.
Oh. So, what can we do for them? What can we do for these challenges? For getting for getting into hyper focus before bed, or like you said, bedtime revenge. How can we help them?
So, hire someone like you, an ADHD coach, right? External structure, alarms, reminders, simplify routines, habit stacking, pairing behaviors, gradual changes. This doesn't have to be all or nothing. And you gotta treat sleep as a core target and not a secondary thing. Sleep is the pillar of mental health. So, it should be the first thing that we talk about. Um, and yeah, interventions have to be tailored to ADHD. So they have to be flexible and structured and realistic, right? Yeah, you can't just spit out a plan and say, "Here, do this."
Yeah, that never works.
Hmm.
Yeah. Okay, so one of the things you mentioned before is using lighting to create that environment,
Yep.
and creating habits to create that environment. So, what can that look like practically?
So, all right. So, if you have an eye mask, right, then that makes the room dark, right?
Right.
That's one thing you can do. You can manipulate light. So even if you don't have blackout curtains, you can always wear an eye mask. You can use a white noise machine or a fan to help you sleep. You can put in earplugs or noise canceling headphones. If you're living in a dorm or in a place where other people are involved, you have to have clear communication about expectations. There should be a quiet time. There should be, something on the door to say, "Do not disturb." I know this is sleep time. Um, People with ADHD, they're more sensitive to environmental inconsistency. So, we want to make sure that they have that consistency, and everything has to be personalized because sensory matters. So the kind of lighting, the kind of bedding, the kind of objects that are around that stimulate us to go to bed and to wake up, right?
Yeah, for sure. Temperature also.
Temperature, generally they tell you that the room has to be cool, it has to be pitch black, there should be no screens, and it sounds common sense when you say it, but it really has to be practiced.
Yeah. It can be. Like you said, I help people with this. Implementing it can be very tricky. One noisy roommate. One late night homework thing that needs to get done. Final season. Any of these little things can throw everything for a loop. One late night out for a good reason, but all your hard devised plans can be derailed for a bit.
Yeah, the people that struggle the most with this are new parents, of course, because they're not sleeping. They have just an atomic bomb is thrown into all of it, right?
That is true. Sounds like you have some first hand knowledge.
Yep.
Yeah.
Yep.
Okay. How does medication affect sleep? ADHD medication.
So we talk about ADHD medication. There's stimulants and non-stimulants. So the stimulants may delay sleep onset. So stimulants, they keep you up, right? They may reduce sleep efficiency. If you're up, you're not going to sleep. But there's nuance. Effects are variable. Some may worsen sleep, some may improve sleep by reducing ADHD symptoms. I have patients that have ADHD, and when they take the stimulants, they say they sleep better because their mind is not racing all the time, and they're just more calm and they can stick to their routines. And so it's not black and white. A lot of times I'll have kids or even adults that need the stimulants, but the timing of it it doesn't work with their sleep schedule, and so they might need some help to fall asleep at night. And so we play around with the timing. We may use melatonin. It's generally not good practice to have an upper and a downer, so we try to avoid that.
What's an
But
upper and a downer? Meaning,
like a stimulant and then a sleep medicine, right?
oh, got it. Okay. What happens with that? Why is that bad?
I mean, that's just bad medicine to have something, keep you up and then take something to keep you down. You got to get to the core of what's going on and minimize polypharmacy.
That's too many band-aids.
Yep.
Got it.
And then I've seen, for example, people with sleep apnea, diagnosed and undiagnosed. So they're tired throughout the day. They're on a stimulant. It helps them stay up, but then they can't fall asleep, so they take something to help them fall asleep, which affects their sleep apnea, and then becomes the whole cycle.
Okay, so it sounds like what you do for this is it varies from patient to patient, but it sounds like there are adjustments that can be made within the medication. Am I getting that right?
Yeah, this is the art of treating ADHD. It's all about adjusting the timing, adjusting the formulations. You monitor sleep changes. So, do you need a stimulant? Do you need to switch to a non-stimulant? Do you need a long-acting medicine or a couple of short-acting ones throughout the day? There's formulations that you take at night and it works. It's a delayed release, so it works as you're waking up. So there's a lot of different nuances to it. It's often a trial and error. And of course, a big thing is treating the underlying sleep disorders. So, if you recognize that there may be one, and you refer the patient out, and turns out they have a sleep disorder, and you address that sleep disorder. First of all, they may not have ADHD, and if they still do, they might need less medicine or lower dosage.
What other sleep disorders tend to come up?
Sleep apnea is one, narcolepsy is one, restless leg syndrome is one.
Okay, speaking of which, what is restless leg syndrome? It seems to come up a lot in the ADHD conversation.
Yeah, so it's an urge to move the legs with an uncomfortable sensation. It's worse when you rest and at nights, and it's relieved with movement. It is more common with people with ADHD. There's some dopamine related mechanism that that's going on. What do we do about it? A lot of times we like to check iron. So sometimes if iron is low, if you replete it, it kind of feels better. If it's really bad, we can give medications like gabapentin. And we like to avoid things that can trigger it, like antihistamines and certain antidepressants can make it worse.
Oh, got it. So it sounds like it's addressed pharmacologically and it's very delicate. I'm getting that right?
Mm-hmm. Mm-hmm.
Okay. You mentioned screens before. How does light from phones and screens affect sleep?
So basically, there's a pathway that goes from our eyeballs back into our brain, and when there's no light, then melatonin is released, right? So that's how that works. When there is light, melatonin is not released. So the specific kind of light is a blue light. So screens, emit this blue light, which, will delay melatonin release, which will delay sleep, right? Not only that, but just, consuming the content on the phone is stimulation. So it keeps you up, whether you're, scrolling or you're watching the news or watching a video. That's activating your brain. So, and that's not the point of sleep. And then, ADHD people, of course, were more vulnerable to this stuff, to digital disruption, as they say.
All right.
So yeah, so we like to use night mode, blue light filters, lower the brightness, switch to audio, podcasts or audiobooks. Maybe someone's listening to us right now going to sleep. I hope you fall asleep.
Hope so too.
App timers, wind down modes, and then a big one, especially with the kids, is you don't charge your phone next to your bed. Tell everyone to charge your phone either far away from your bed or in a different room. Get an old school alarm clock. Make it difficult. You got to get out of bed to turn it off. That kind of thing.
The rolling alarm clocks, you know those?
Yeah,
All
yeah.
right.
I had one. I had one that it was on my phone, but you had to either solve a math puzzle or scan a barcode or something like that.
Right. Higher tech version of the rolling alarm clock.
Mm-hmm.
What are other, I guess, bedtime activities for people who want to, I guess, feel less stimulated before bed that are not phone related that can help people? Meaning, if we want them to be on their phones less. What can we offer them instead?
It's a good question. I'd say less is more. So you want to be bored, right? That's the whole point. But reading helps, right? Again, you want to make sure it's not too bright. A lot of people like to read on their iPads or their phones, but that's not going to work. The bed really should be for sleep, and that's it. Nothing else should be going on in bed. You want to monitor your caffeine intake, your alcohol intake, substances, and that's pretty much it. You want to have a bedtime routine. So a big thing that has made a big difference in a lot of patients is having a bedtime alarm. A lot of people have an alarm to get out of bed, but you should have an alarm to go into bed.
Oh, interesting. I feel like with my clients, a challenge can be when there's a very hard line. They really don't want to listen, kind of like what you mentioned before.
Yeah.
Have you helped people address that?
So yeah, I mean, with every patient, I sit down and I ask them, "What time do you want to wake up?" And based on their age, I tell them you need X amount of hours. So if they're an adult, they need 8 hours of sleep, let's say. So if they tell me they want to wake up at 8 in the morning, I say you got to be asleep at 12. How long does it take you to fall asleep? Oh, it takes me half an hour in bed to fall asleep. Okay, so half an hour before that is 11:30, and then how long does it take for you to stop what you're doing and get ready for bed? Oh, that's another 45 minutes. So you go back 45 minutes. So that's when your alarm should go off. Alarm goes off, you stop what you're doing, you start your bedtime routine. You go to the bathroom, brush your teeth, take a shower, all that stuff.
So it sounds like you want the alarm not to be a hard stop in terms of going to sleep. You want the alarm to get you moving towards sleep. That's much easier to listen to.
Yeah.
Got it.
Yeah.
And do these interventions you've mentioned, how do they affect waking up in the morning?
Well, I mean, if you're falling asleep regularly and your sleep quality is good and you're not accumulating this sleep debt, you're going to wake up more refreshed. You're going to wake up more alert.
Should be in much better shape then.
Yeah.
Awesome. Any other issues related to ADHD and sleep that we didn't touch on?
With kids, it's very important to intervene early. Childhood sleep problems may predict later ADHD related sleep issues, so you want to get a whole handle on that. But yeah, I mean, one thing would be to get a handle on what's going on. Another thing would be to rule out any actual sleep disorders. So that, I think that's a conversation to be had with your psychiatrist, with your primary care, with your sleep doctor, because you want to make sure that's ruled out before you go down the ADHD path if you're having sleep problems.
Okay. Anything else you wanted to mention today about this?
The message of hope. Sleep problems in ADHD are real. They're common. They're treatable, but they reflect the biology and not lack of effort. A lot of ADHDers, they've been told they're lazy or any of that kind of stuff. But it's not laziness, and it can be helped and it can be treated.
Okay, Dr. Linzer, always great to chat. Thanks for joining us again.
Thanks for having me.
Thank you again for listening to this episode of the ADHD Heroes podcast. For questions about the podcast, you can email us at adhdheroespodcast@gmail.com. Also, for sponsorships or to share your story, your ADHD story, you can also email us at the same place, adhdheroespodcast@gmail.com. To be in touch with me about ADHD coaching, writing, or speaking engagements, you can email me at rsreichadhdcoach@gmail.com. Be sure to check out my website, rsreich.com, adhdcoach.com. You can follow me on LinkedIn, or you can check out my blog on nefesh.org. Check out my blog there under my name. Important disclaimer: podcasts are great, but they do not take the place of mental health help or medical help. So if you need help with mental health or need a doctor, be sure to be in contact with some of them. Please, if you like this show, please rate, review, and share with a friend. That's how these things get out there. Thank you again for listening, and thank you to our producers at Pretty Easy Podcasts.